Schizophrenia is a term that is often used incorrectly. Here are the DSM-5 criteria for schizophrenia. You must have 2 or more of the following symptoms for a significant amount of time over at least 1 month. And at least one of the symptoms has to be delusions, hallucinations, or disorganized speech. And negative symptoms may be one of the symptoms as well. Negative symptoms have to do with things like poor cognition, low affect, diminished emotional expression, avolition. For a significant period of the time that you're experiencing these symptoms, your functioning must be diminished. So it must impair your functioning socially or academically or occupationally. The symptoms have to continue for at least 6 months. So this is helpful because a lot of times people may have brief psychoses, but with schizophrenia, it's chronic and they have to persist for at least 6 months. The symptoms can't be caused by a medical condition or substances, and you can't meet criteria for a schizoaffective disorder. The symptoms can't be due to bipolar disorder because sometimes people do have bipolar with psychosis, and the symptoms can't be due to depression because sometimes people with severe depression may have depression with psychosis. Also, if the person has a diagnosis of childhood autism, they can meet criteria for schizophrenia as long as the symptoms of schizophrenia are prominent and present for at least a month. There are subtypes of schizophrenia such as disorganized type, paranoid type, catatonic type, and so this may make the diagnosis even more confusing. The treatment for schizophrenia are medications called antipsychotics, but there are newer medications that are available as well. Some medications can be taken orally. However, a lot of patients with schizophrenia experience anosognosia, which is when they don't believe that they actually have a medical or psychiatric condition. So they don't believe that they need to take medications. This may make treating schizophrenia even more challenging. Additionally, many people with schizophrenia are also traumatized and may have a childhood history of neglect or abuse. So that may make the symptoms additionally way more difficult to diagnose. Many people self-soothe with their pain using substances. Substances plus schizophrenia may also make the clinical picture very difficult. Many people who are diagnosed with schizophrenia initially have something called a prodromal phase. This looks like a depression. So you may hear cases of people in their youth having depression and being isolated and not having overt symptoms of schizophrenia such as hallucinations or delusions. But then when they go to college and they're under a lot of stress, they have what's called their first break of psychosis, where then they begin to experience some of those necessary criterion A symptoms like delusions, hallucinations, or disorganized speech. It's important to know what your options are. There are treatment benefits, alternatives, and risks to taking medications. However, most experts will agree that the benefits far outweigh the risks when it comes to medications. There are also therapies that may be helpful for supporting those with schizophrenia. Peer support groups, grassroots organizations, and one-on-one behavioral therapy may be helpful. One of the newer areas of treatment are focusing on the negative symptoms. So negative doesn't necessarily mean bad. Negative just means symptoms such as poor thinking or difficulty focusing, low affect, avolition. All of those things may prevent the person from getting things done in life or having relationships. So many of the newer medications are targeted towards those negative symptoms. Did this help you to understand schizophrenia? Let me know what you think in the comments below.